Okay, so I'm going to talk about today COVID-19 and the weight management. Other than the old age, now we understand that the obesity or overweight is a leading cause of a severe complication of COVID-19 and also leading cause of a death and hospitalization. So in this brief short webinar, I'm going to talk about the several highlights here. First, I'm going to talk about the clinical relationship between COVID-19 and overweight and obesity. Excuse me. An overweight and obesity fact and what causes overweight and obesity, and the secret to losing weight fast and keep it off for life. And at the end, I'm going to go ahead and share with you a special bonus that I'm going to be offering to all of you guys attending this short webinar. All right. So I want to share with you this study recently came out of New York City, actually New York Times, and obesity linked to severe coronavirus disease, especially for younger patients. And this is from New York City, over 4,000 COVID-19 patients at NYU and Gun Health Center. And according to Dr. Howard, he says obesity is more important for hospitalization than whether you have a high blood pressure or diabetes, though these often go together. It's more important than coronary disease or cancer or kidney disease or even pulmonary disease. So obesity is now known fact that it's more important for hospitalization associated with COVID-19. And this is a French study, and it states that nearly half of 124 COVID-19 patients in Lille, France, had obesity, twice the rate of a comparison group of intensive care patients hospitalized for other reasons last year. And the study also reported that the need for mechanical ventilation increased with higher body weight. This is a Chinese study among a group of 112 COVID-19 patients. It was reported that 17 patients who died, 15 were either overweight or obese. So that's more than half, the majority of the patients who died are known to be either overweight or obese. So now let's talk about the United States overweight obesity facts. And I remember one of the French scientists warning the U.S., the Americans, saying that, hey, you guys better watch out because you guys have a very high rate of obesity and overweight. And so that was quite alarming. And according to a recent statistic, 70% of Americans are either overweight or obese. And out of that, 40% of Americans are obese. That's 80 million people. So think about if people were infected with COVID-19, and let's say half of them are obese, that's 40 million people that we're talking about. So again, huge number of American adults are now considered obese. And no wonder now we are facing obesity epidemic in this country. And the 70% of diseases are related to overweight and obese. So we're talking about heart disease, cancer, diabetes, pretty much what we call progressive chronic diseases are now all related to overweight and obesity. And overweight is defined as a BMI, which is a body mass index of 25 to 29.9, and obesity is defined as BMI is over or greater than 30. So in a nutshell, overweight and obesity is now defined as a medical disease, it's a medical condition. So this will explain why it is so hard and difficult to lose weight if you try to lose weight on your own, because this is a medical condition and therefore you need a medical supervision from a doctor or from a medical specialist, okay? And so keep that in mind. So the overweight obesity problem is not just, hey, I'm just too lazy, I'm eating too much, not exercising. No, it is now considered a medical disease, so you need a medical intervention, okay? So, all right, now let's go ahead and play a little game. I call this the Price is Right game. So anybody wants to guess how much of a body fat, this blob of fat I'm holding? Anybody want to venture to guess? Yes, it's a 5 pounds of body fat, right? I mean, looks a lot bigger than 5 pounds because don't forget the body fat is much lighter, actually lighter than water, right? So that's why it looks a lot bigger than actually it weighs. So body needs to develop or build 4 miles of blood vessel to supply this blob of body fat. So now think about how hard, okay, how intensely your heart has to work to pump all the blood to this body's fat cells, right? So obviously they can cause a cardiac problem, heart disease, and then according to Mayo Clinic, every pound you're putting on your body gonna add 4 pounds of pressure, stress on your joint, specifically weight-bearing joint. So that means if you're putting on 5 pounds of body fat, that's equal to 20 pounds of pressure on your joints. So think about if you're carrying about 20 pounds of fat, now you're carrying roughly about 80 pounds of pressure on your weight-bearing joints. So we're talking about lower back, hips, your knees, and ankle. So now, does that make sense why people who are having chronic back pain or hip pain need to get rid of this extra body fat? And this is why we focus so much on our patients who come in for chiropractic consultation and for treatment, that we address these weight problems firsthand, because by far this is far more important than anything else, right? However, the great news is this: when you lose body fat, your health can improve tremendously, pretty much in all aspects of your health. The quality of life will improve in terms of 95% of patients' mortality reduction. So let's talk about type 2 diabetes, for example. If you lose body fat, so when I say lose fat, I'm not talking about losing huge, like ton of body fat. Even if you lose only 5 to 10% of weight, it could have some significant impact on your overall health. So for example, type 2 diabetes, 83% will be resolved if you lose body fat. And cardiovascular disease, 82% reduction if you lose body fat. Hypertension, between 52 to 92% resolved, right? So you can see all these, what we consider a chronic, progressive medical condition or diseases, can be tremendously alleviated or improved by losing body fat. So who's Dr. Chang? Hello, this is Dr. Chang, and I'm a practicing clinical chiropractic physician, and I've been in practice for 19 years. And I'm currently a clinic director of Chirowell, and I used to own multiple clinics in different states. And currently, I'm running a #1 online doctor supervised weight loss program, and I helped transform thousands of patients' lives through natural health and wellness care, including chiropractic, nutrition, and the weight loss or weight management program. And this is the portrait picture of our lovely family. And we took this picture last year on Christmas Day, and we had to take a quick selfie picture. So I asked my family members to put on a fake best looking smile. So this is what they look like, and kind of resembles this, Wallace and Gromit. All right, now let's talk about what causes overweight and obesity. I know some of you guys coming out of quarantine feel like this bear coming out of hibernation. Here's #1 medical myth. So this is what your doctors are telling you or have been telling you for the last 50 to 60 years. Eat less and move more. Are you familiar with this show? It was one of the biggest hits a few years ago. Handful of contestants, they lost a ton of weight. They lost hundreds of pounds of weight. But what happened after the season is over? How come there's no reunion show? Because 13 out of 14 contestants gained their weight back. So this is a extreme form of eat less and move more. But the problem is this is not a sustainable weight loss model. You cannot do this for long term because pretty much you'll gain weight back. So cutting out calories and try to burn more calories to exercise do not work for long-term weight loss success. So now let's talk about food versus exercise. Which way is it easier to keep the weight off, okay, and to lose weight? Munching on this big giant donut and then running on a treadmill for 2 hours to burn that extra calorie off, or simply just skipping the donut. I mean, common sense is just not eating the donut, correct? So in other words, you cannot out-exercise eating or dieting. And speaking of eating or food, not all calories are the same. So on the left-hand side, I have a couple grilled salmon fillet, and the right-hand side, I have 3 donuts. So let's suppose that they're exactly the same calorie. Do you think they're going to have an exact same impact when you consume them, when you eat them? When they go into your body, get digested, do you think they'll have exact impact in terms of weight gain? What do you think? Well, the answer is no. So not all the calories are the same, and we'll talk about why. So the weight gain is not from too much calories, okay? Because not all calories are the same, and weight gain is not from too little exercise. Okay, so exercise, unfortunately, the physical activities counts only for 5% of our total energy expenditure, and 95% is from BMR, basal metabolic rate. So now the weight gain is from too much hormonal problems. In other words, when we eat certain type of food, they can actually create to produce more hormones. So what hormones am I talking about? So in other words, weight gain is a hormonal disorder, hormonal problem. More specifically speaking, insulin is the hormones that we're interested in. Okay, so what's insulin? I know some people don't even think that insulin is a hormone, but insulin is one of the major hormones in terms of controlling our sugar level in our blood. So for example, this insulin is produced and secreted from pancreas, from beta cells, and its job is to store extra sugar that's floating in the blood into our cell. So what is the insulin's job more specifically? So insulin's job is this. So this is a very interesting photo. It really caught my attention because it explains exactly how the insulin works and how the food get into our system. So this is a photo of a subway station, busy subway station in Tokyo, Japan. And the food represented by people standing in line. So they're trying to get into the train, which represent our cells in our body. And these gentlemen in uniform are called the pushmen. So their job is push people into the train. So this is insulin's job. Okay, so the people standing here are food that's coming into our system. And if there are more food than we can handle, then the insulin gets released and these guys come to work and they have to work very hard to push all this excess food into the cell. And this is how a cell gets fat. So in other words, the obesity or overweight or gaining fat is an insulin problem. Of course, if we eat too much food or eating too often, right, it's going to put insulin into overdrive and insulin have to work hard. So this is why people who are already overweight, obese, they all have an insulin problem. And we call this insulin insensitivity. So they already have high level insulin. So no matter how much they eat, the cell's going to get fatter. So this is kind of like a catch-22. So then how do we handle, okay, how do we take care of this insulin, right? So if the weight gain or obesity overweight issue is the insulin disorder, insulin problem. How do we get rid of this problem? Okay, so we'll talk about that next. So what's the secret to losing weight fast and keeping it off for life? Again, it's not through exercise, not cutting calories, it's through insulin control. So how do we do that? Okay, definitely we're not going to talk about controlling insulin with medication or any other artificial means, but I will show you how we can control insulin very effectively, naturally. So now let's go ahead and I want to tell you a little bit of my story. So I was born into a family of diabetes. My grandma passed away of diabetes complications from diabetes. She passed away with the kidney complication, and my uncle, my younger uncle, she also passed away. She was in dialysis, and she passed away because of the kidney failure. And my dad, thank God, is alive, but he's again having some complication. He had a couple minor stroke, and recently he had a surgery because of blood clot. So now exposed to all this familiar or genetic factors, so I was worried about my health and well-being. So I wanted to look like this guy, stay lean and healthy. So back in college, I was start exercising, really try to work out 3 to 4 times a week to keep myself in shape. It's lots of protein because that's what I was told to do to build a muscle to keep myself lean, and drink a lot of protein shake and eat 6 meals a day. So you want to, so they told us you have to eat 6 meals a day. You constantly keep your metabolism up, right? So the question is, did it work? The answer is not really, because I felt more tired, I felt hungrier, I ended up gaining more weight, my blood pressure went up, which wasn't good, and acid reflux. So let me ask you a question. When you exercise, when you have a really good workout, do you feel full or do you feel hungry? You feel hungry, so that's called compensatory response after workout. That's why after with exercise, it's really hard to lose weight because your appetite goes up. So me and my buddy, after a good workout back in college, we got so hungry, and we ended up going to KFC, order a bucket of KFC chicken, and just yeah, pretty much ate the whole bucket of chicken. So no wonder why we were losing weight, right? And but this is what happened. This is what turned my life around a few years ago. And I discovered this ancient secret technique, a diet technique. And I met this group of Orthodox monks a few years back, and they became my spiritual mentor and friends. And what I noticed from their lifestyle was very fascinating, because they were eating only 1-2 meals a day, not a lot of food, and eat mostly carbs, and exercise very little. And of course, they pray a lot because they're monks. But this was in stark contrast of my lifestyle. I was eating like 3 to 6 meals a day. I was eating mostly protein. I was exercising very intensely, a lot, like 3 to 6 days a week. Of course, I wasn't praying a lot. But and yet these monks were having more energy, lean. They appear very healthy. So I looked further into the monk's lifestyle. So there was a multi-year study from 1994 to 2007. 1,500 monks were living in the Mount Athos, is a small Greek island, and discovered that there was no long history of no lung cancer or bowel cancer. In other words, pretty much all the monks who are living there who followed a similar lifestyle are pretty much all healthy. So I knew the secret was the lifestyle of fasting. Okay. So of course they were fasting and a lot of prayer, but so fasting. So I was wondering, can I do the fasting, right? Because I've never ever done fasting before in my whole lifetime, and frankly, I was afraid. I was kind of scared. What if I fast, and what if I start myself, and my metabolism slows down, lose muscle, and I'm gonna be hungry all the time? So I did further study or research on my own, and I discovered that some of the famous historical figures, right, the political or spiritual figures like Jesus Christ, he fasted for 40 days, but he didn't die. He survived, and Gandhi did 27 straight days. He didn't die, and Benjamin Franklin. Frankly, I don't know how many days of fasting he did it, but he, on regular basis, recommend his clients or patients to fast and rest for proper healing. And this gentleman here, his name is Angus Bierby, and this guy holds a world Guinness Book record for the longest ever continuous fasting. So do you know how many days he fasted? Any guess? Yes, he did it for 384 days straight. Over a year, he went on fasting. He did it for medical reasons, so he ended up losing 267 pounds, and this is what it looks like at the end. So even if you do the fasting that long, you're not going to die, right? So that was kind of showing that, okay, well, fasting is at least safe. And also, there were so many other um, benefits from fasting. It helps weight loss and improves insulin sensitivity, which is, again, uh, quite fascinating because the insulin sensitivity is what causes weight gain. So if you can improve insulin sensitivity, obviously then it can help lose weight. And speed of metabolism, yes. So when you fast and do it correctly, your metabolism can actually increase rather than decrease, and promote longevity, improves hunger, improves eating patterns, improve brain function. And based on the anecdotal stories, some of these Greek philosophers like the oh gee, I forgot the name of the Greek philosopher, but yeah, Pythagorean. When he had a class, he told his students to fast before he joined this class, so make sure their brain is alert and improve immune system. Yes, and this is now more than ever important to maintain the immune system. So fasting can help improve immune system. Based on the study from USC a few years back, if you fast like 3 straight days, it can actually help reproduce healthy stem cells, which can actually produce immune cells, right? So again, the fasting benefit has so many health positive, positive effect on overall health. So now, so how do we fast to control insulin and burn fat? So this is what I'm going to tell you. I'm going to recommend. Actually, this is what we recommend to our patients to do as part of our doctor supervised weight loss program, and based on this whole concept of fasting. And one of the key things when it comes to weight loss is when to eat, right? And we are all told what type of food, what to eat, but never really told when to eat. So there's two sides to weight loss: what to eat and when to eat. And so our program, and what I recommend to patients, is also when to eat. This is as much important. In my opinion, this is actually far more important and crucial to weight loss than what to eat. So we employ intermittent, or we call it micro fasting. You can pretty much start out eating 2 meals a day. Eventually, you can eat 1 meal a day, but start out 2 meals a day, and eat lunch and dinner between 12 p.m. and 8 p.m. And of course, you want to eat balanced meal, protein, vegetable, and fruit. So this is not an extreme fat diet, not like keto diet, which is 75% dietary fat. And definitely, we don't recommend doing that. And no snacking. Drink plenty of water, half a body weight in ounces. Get plenty of sleep, 6 to 8 hours. On average, if you follow this protocol, men can lose about a pound per day, and women can lose about half pound per day. Again, if you do this correctly. But the question is, can I do it? Right? That's another question. I mean, I can tell you what to do, but can I implement this? Can I execute this? It's a different question. Think about smoking, right? Can anybody quit smoking? Of course they can. But is it easy to quit smoking cold turkey? The answer is not really. So that's why they need some help. So people want to quit smoking, they might try like nicotine gum or nicotine patch to kind of ease the process. So it can help them to quit smoking kind of gradually and effectively. So of course you can do this if you, so you can do this either kind of hard and kind of cold turkey way, or you can do it in an easier way following, for example, like our program. So our program is based on, again, the science based on this concept of intermittent fasting. And we can help people lose about 20 to 40 pounds in just 6 weeks. And this is number one, doctor supervised weight loss program. And we had over 130,000 patients successfully completing the program all over the country. And this is based on 6 weekly online coaching call with the doctor. So pretty much every week, I'll be checking in with our patients, coaching call, and then daily supervision by doctor. And this is the highlight of our program, so to speak. So on daily basis, we'll be supervising or monitoring our patients through special software. And then monthly maintenance coaching call and IUP test. This is a specialized 24-hour integrated urinalysis panel. You cannot find this test anywhere else, any other clinics or hospital. Fortunately, we are one of few clinics that run this test. So with this test, we can pretty much forecast or know beforehand what kind of weight problems you're going to have, weight stalls. So we can check your digestion, your absorption, how well you're going to be absorbing the food that you digest. I mean, a phenomenal test. You can get so much information about you and help you navigate through the process weight journey. And of course, it requires no exercise. So it's great that you don't have to exercise, because especially if we're in quarantine, you know, most likely we're not going to be exercising as much. No pills, no prepackaged food, no shakes, safe, effective, affordable. So that's our program. So before, you probably felt like this kid. You try many different type of weight loss or diet program and failed at it miserably. And like this kid, you've fallen off the bike so many times, like, oh, I cannot do this anymore. You're just crying and, I'm going to give up, right? So you probably feel like this kid, but now you can feel like this kid here. So she's not doing it on her own. She's actually getting help from her dad, holding her back. And she probably has some training wheels before too. So now she can just pedal her bike and she can just go straight. Don't have to worry about falling off the bike. So this is why, again, remember, 99% of the time people fail with the weight loss because it's a medical condition and medical disease. So you need some type of medical supervision or monitoring. Okay. So ultimately, it's your choice. You could make a decision now to change your life. Okay. Take some weight off of your body to stay lean and healthy, or just carry on your life same as before, carrying extra body weight. But at some point, speaking of COVID-19, we're all going to be exposed to it or come across COVID-19. Who knows? It could be months or it could be a couple of years later. But as far as our health is concerned, there's no known vaccine developed at this point. Who knows how long it's going to take, months or years. So in the meantime, how are you going to defend yourself against COVID-19? God forbid, if you got an infection, how your body's going to fight it off. So wouldn't your body be better off fighting it off when it's lean and healthy rather than it's heavy, carrying extra weight? So again, it's your choice. So now this is our special bonus. So thanks for sticking around. So I'm offering 45-minute free online consultation. Normally it's $297 value. And so I'll go over everything about your weight loss history and also go over our program if you do qualify for our program. So simply what you need to do is you need to click on the link that I'm going to put in the chat box. And if you click on it, it will lead you to our online intake patient intake form, and just fill it out as much as you can. And then I'll be able to review your form and then see if we can qualify you as a candidate for our program. And then we go from there. Okay. So this is it. And if you have any questions, please contact our office at 480-485-6655. Call or text message us or visit our website at www.chirowellaz.com. chirowellaz.com. All right. So thanks for attending my short webinar, and look forward to meeting you and on our online consultation. Thank you and take care. Bye-bye.